Ladies, it's October. It's Breast Cancer Awareness Month. 1 in 8 women in their lifetime runs the risk of being diagnosed with breast cancer. I have the distinct privilege of being here today at JC Plastic Surgery with a phenomenal doctor who specializes in breast reconstruction. Dr. Chang, thank you so much for taking the time out to speak to all of us here at Atlanta to ask the questions we have about breast reconstruction. My first question for you is, what exactly is breast reconstruction?
Well, I'm glad to be here. Thank you for having me. Breast reconstruction is a very large word, but to try to make it simple, it is the restoration of our female organ, which is the breast. Breast can be either deformed or it can be removed for various reasons, but the main reason is breast cancer treatment. So reconstruction mainly comes after a mastectomy, which is a removal of the breast tissue.
Okay. At what stage of diagnosis would a patient set up a consultation with you?
So usually patients come to me once they already have the diagnosis of breast cancer. They see the specialist first, they get the diagnosis, they come up with a treatment plan, and when they come to the conclusion that there will be maybe a deformity or a lack of breast tissue in itself because the patient needs a mastectomy, that's when the plastic surgeon gets involved.
Will the mastectomy and the reconstructive surgeries be scheduled at the same time, or will a patient need to have several different surgeries, a couple different surgeries? How does that work?
So in the old days, a lot of the surgeries happened separate.
Okay.
So patients would get the mastectomy first, and then they would see a plastic surgeon afterwards to get the reconstruction. And that's what we call delayed reconstruction. But fortunately, medicine has advanced, and we have seen that doing it together and starting at least part of the reconstruction at the same time of the mastectomy has given us much better results, not only from the surgical standpoint, but it also is emotionally much better for the patient. So they don't wake up without breast, and they at least wake up with something that's in process of getting complete again.
So along those lines, part of feeling whole and normal, when can a patient resume wearing normal bras that make us feel sexy and great about ourselves?
So that varies from surgeon to surgeon. In my hands, as long as they have no issues and they've healed completely, they can wear whatever they like, sexy, fun lingerie at 6 weeks from the surgery.
So how long is the recovery for this sort of surgery? When could a person resume their life, go back to work, drive a car, take care of kids, those sort of things?
So recovery really depends on the type of reconstruction you get. But let's not forget that you are actually getting a mastectomy together with the reconstruction. So it can vary from anywhere from 2 to 4 weeks. However, that doesn't mean that you're bedridden for that period of time. It's just that you are limited to certain activities. You can't do anything strenuous or exercise. Usually, on average, my patients go back to at least trying to resume their normal activities within 2 to 3 weeks. And then driving, you have to be safe, so I try to tell them don't drive while you're on pain medications and drive when you feel safe. And that's about 2 weeks after the surgery.
I know one question that all of us probably have is, at the end of all of this, will the breasts look the same that they did before surgery?
Well, my hope as a plastic surgeon is that they will actually look better than before. However, once you have a mastectomy and you have reconstruction, they're not quite the same. So that's why we have different techniques for reconstruction, and if you want a more natural look with a natural feel, we usually use tissue from your body to make the breast. However, if you want them a little bit more enhanced, a little bit higher, a little bit perkier, we try to use an implant for the reconstruction. When you do that, of course, they look great, but they don't feel and they don't look quite as natural as before.
So the patient is in full recovery and finally feeling great. And my question to you is, do we still need to do mammograms?
So once you've completed your treatment and your reconstruction, you will have to do your follow-ups, either with your oncologist or your breast surgeon. And they will be the ones who will tell you whether you need a mammogram or any other imaging studies. And they will also tell you whether you will need it every 6 months or every year.
So here it is, October. It's Breast Cancer Awareness Month. Do you have anything in particular, a message for all of us here in Atlanta that you would like to leave us with?
So I think breast cancer touches us in one way or the other, and I want to let the ladies know that it is important to do self-exams. Also do your yearly mammograms when indicated, and in doubt, ask your doctor. And also know that if you do get breast cancer, there are many things that we can do to make you feel whole and beautiful again with reconstruction.
So I would just like to take a minute to brag on Dr. Jenny Chang. Not only is she an amazing human being, she is an amazing surgeon. She was just written up in Atlanta magazine as one of Atlanta's powerhouses. I couldn't agree more. She's a very impressive human being. Yes, if you call and you have questions about breast cancer reconstructive surgery, she's your woman. But not only that, she can help you with any plastic surgery questions you may have.